అందరికీ నమస్కారం. గుడ్ మార్నింగ్. ఐఎమ్ డాక్టర్ అరుణ సుమన్. డాక్టర్ శాంత కుమారి. షీఈ్ డాక్టర్ శాంత కుమారి. షీఈ్ ద ఫీకో ట్రెజరర్. ఫీకో అంటే ఇంటర్నేషనల్ ఆర్గనైజేషన్ ఆఫ్ ఆబ్స్ట్రిషన్స్ అండ్ గైనకాలజిస్ట్. అంటే మొత్తం వరల్డ్ మొత్తం లోకం మొత్తం ఉండే గైనకాలజిస్ట్లో షీఈ్ వన్ ఆఫ్ ద లీడర్స్. సో ఇండియాలో ఒక ఆర్గనైజేషన్ ఉంది, అది ఫాక్సీ అంటారు, విచ్ ఇస్ ద ఆర్గనైజేషన్ ఆఫ్ ఆల్ ఓవర్ ఇండియా వేర్ 270 సొసైటీస్, అంటే ఆల్ ఓవర్ ఇండియాలో వేరే వేరే స్టేట్స్ డిస్ట్రిక్ట్స్ నుంచి 270 సొసైటీస్ ఉంటాయి. అందులో చాలా మంది మొత్తం అరౌండ్ 46 to 50,000 మధ్యలో మెంబర్స్ ఉంటారు. సో దానికి ఒక లీడర్ అనమాట. సో షీ విల్ టాక్ అబౌట్ ద డ్యూటీస్ అండ్ వాట్ ఎవర్ functionalities of the organization. Thank you.
Good morning andi. Namaste. I am Dr. Shanta Kumari. Then koncham Telugu English kalli maatladochu kada? English. You want English, they want Telugu. We'll talk in between both. We are from Hyderabad, so
No, we are not from Hyderabad.
I know, but unfortunately most of my people are in Telugu and I am also okay.
Yeah, please repeat.
Okay. That's a little difficult. Let's see what we can do. So namaste andi. I am Dr. Shanta Kumari. Ippude Aruna cheppinattu I am the FIGO International Gynaecology Society Treasurer and the immediate past president of FOXY. FOXY is the Federation of Obstetrics and Gynaecological Societies of India. I was the All India President last year. And mana Hyderabad Society mo Obstetrics and Gynaecological Society of Hyderabad, OGHS. I am the current president of OGHS. So we are very happy to have you all here. A warm welcome from Obstetrics Gynaecological Society of Hyderabad. Mimmalni enduku ivala pilichamante we wanted to update you about the 66th AICOG, All India Congress of Obstetrics and Gynaecology, which the OGHS is doing for the FOXY, and we are conducting this conference from 6th to 10th of January at HICC High-Tech, Hyderabad. So we wanted to update you about this AICOG Congress. So we are here. So I am the organizing chairperson of the Congress. Dr. Vindhya, T. Vindhya, she is the organizing secretary of the Congress. Madam is the past president of Obstetrics Society of Hyderabad Society. And Dr. Aruna Suman is the organizing secretary of this AICOG Congress. Madam was the vice president of OGHS. And we have Dr. Jamuna Devi, Madam, who is the treasurer of the Obstetric and this AICOG Congress, and Madam is the past president of FOXY Hyderabad, which is OGHS. So we just wanted to update you about this AICOG Congress. Now the AICOG Congress is the mother of all congresses of FOXY. The All India Congress, which is the main congress of the FOXY, every year it rotates in one zone. North, South, East, West. So in South, this has come to our city Hyderabad. We had conducted this AICOG thrice before. The last time was in 2011, where I was the organizing secretary and they were the organizing joint secretaries. That time we had done this at same HICC High-Tech. And before that, in 1998, Hyderabad Society had organized this Congress. And before that, in 1958, the first time AICOG had come to Hyderabad. So this is the fourth time the All India Conference has come to Hyderabad. So it's a matter of great pride that we are organizing this All India Congress at Hyderabad, because this is where most of the gynecologists will be attending the Congress. We have about 40,000 people in FOXY. So usually the All India Conference AICOG about 10,000 people attend the Congress, especially depends on the place. Being Hyderabad, we are expecting a good crowd. We are going to have more than 11,000 delegates at Hyderabad from 6th to 10th of January. So why is it that AICOG is very important? మీకు తెలుగులో కొంచెం చెప్పాలంటే ఆల్ ఇండియా కాంగ్రెస్ ఆఫ్ ఆబ్స్టెట్రిక్స్ అండ్ గైనకాలజీ అంటే ఇది మా ఫాక్సీ యొక్క ముఖ్యమైన కాన్ఫరెన్స్. ఇది మనకు 4వసారి హైదరాబాద్కి వచ్చింది. ఫాక్సీ హిస్టరీ ఇస్ 70 years. ఇన్ 70 years ఆఫ్ హిస్టరీ ఆఫ్ ఫాక్సీ మన స్టేట్కి ఇది 4th టైం మనము కండక్ట్ చేస్తున్నాం. దాంట్లో ఇన్సిడెంట్లీ థర్డ్ టైం అంటే 2011లో కూడా మేమే ఆర్గనైజ్ చేసాము. ఇప్పుడు 2024లో కూడా మేమే ఆర్గనైజ్ చేస్తున్నాం. వీఆర్ వెరీ హ్యాపీ. ఇది ఎందుకంత ఇంపార్టెంట్ అంటే ఇది ద మెయిన్ కాంగ్రెస్ ఆఫ్ ఫాక్సీ. ఫాక్సీలో వీ హ్యావ్ అబౌట్ 40,000 గైనకాలజిస్ట్ ఆల్ ఓవర్ ద కంట్రీ. 270 సొసైటీస్ ఆర్ దేర్. 270 సొసైటీస్ ఉన్నాయి ఆల్ ఓవర్ ద కంట్రీ. సో ఈ అన్ని సొసైటీస్ కూడా చాలా ఇంపార్టెంట్ కాన్ఫరెన్స్ అంటే ఆల్ ఇండియా కాన్ఫరెన్స్. ఇది కాకుండా ఇండివిజువల్గా జోనల్గా చాలా కాన్ఫరెన్సెస్ అవుతాయి, బట్ దిస్ ఇస్ ద మెయిన్ కాన్ఫరెన్స్ అనమాట. ఈ కాన్ఫరెన్స్ ఒక ముఖ్య అంశాలు ఏంటంటే వీఆర్ టాకింగ్ అబౌట్ సైన్స్, వీఆర్ టాకింగ్ అబౌట్ క్లినికల్ కేర్, వీఆర్ టాకింగ్ అబౌట్ రీసెర్చ్, వీఆర్ టాకింగ్ అబౌట్ ఎడ్యుకేషన్, వీఆర్ టాకింగ్ అబౌట్ అడ్వకసీ, వీఆర్ టాకింగ్ అబౌట్ ద పార్ట్నర్షిప్ between the public and private partnerships. We are talking about the government and the Foxy partnerships, and we have lot of advocacies with many of the partners, and like UNICEF India, the WHO in India, then the international organization BMGF, the Bill Melinda Gates Foundation, the Packard Foundation. So many foundations are associated with us, and for advocacy we believe in women's health. We are gynecologists taking care of women's health. So for us advocacy is very important. It's not only treating the woman whom we are seeing every day, but it's also to look into the fact that we see socially what is it that all of us can do as a society for taking care of women's health. Because unless the woman is having the best of health, we will not be able to achieve anything, I feel, in the whole world, not only in our country. ఈ విషయం కాకుండా మోస్ట్ ఇంపార్టెంట్ థింగ్ ఇస్ మెటర్నల్ మార్టాలిటీ రేట్. మన మెటర్నల్ మార్టాలిటీ రేట్ ఆర్ ద నంబర్ ఆఫ్ విమెన్ హూ ఆర్ డైయింగ్ బికాస్ ఆఫ్ చైల్డ్ బర్త్. మీకు అందరికి తెలిసిందే MMR. India was having a very big maternal mortality rate, but now we are very, very lucky and happy that the government is so keen, along with the federation, the Foxy, we are all working to try to reduce the maternal mortality rate, and we are extremely happy because Telangana has got one of the lowest maternal mortality rate. It's about 40 to 36. It is not yet announced, but the now present value which is there is about 40s. And why I am very happy is because we are going to soon reach a single digit target. So we are all looking forward to the SDG, Sustainable Development Goals 2030, where India has to reach the SDG goals. We have to reduce the maternal mortality rate to less than 70. So hopefully we should reach this SDG goal by 2030. And with the commitment of the government, the central government, our Prime Minister Shri Narendra Modi ji, our Mansukh Mandavia, who is the Health Minister, they have been working very hard for the health of women. And all coming to the local governments, now we have a new government. We have Shri, I think, Revanth Reddy garu, who is the Chief Minister, and Raja Narasimha garu, who is the Health Minister. They are just taking over, and I am sure that they will continue the work for reducing the maternal mortality rate as the previous governments. We had the KCR government and Harish Rao was the Health Minister. They were all committed to reducing maternal mortality rate. So they worked very hard, and we gynecologists have supported them a lot. So the maternal rate had come down drastically in Telangana, and I am sure the present government, the present Health Minister, and the whole government will work very hard to see that we achieve this single digit maternal mortality rate. So that is the aim of our Foxy, the vision and mission of Foxy. Then the other most important initiative which I had actually started was Dheera, No to Violence Against Women. Dheera ante courage. 2016 lo No to Violence Against Women initiative I started, and we as a whole have been advocating this. Because obstetrician gynecologists are the first point of contact. ఎవరికైనా ఏదైనా ప్రాబ్లం ఉంటే ఆడవాళ్ళు ఎవరి దగ్గరికి వెళ్తారు? ఫస్ట్ పోలీసు లాయర్లు దగ్గర కాదు, ఫస్ట్ వచ్చేది వాళ్ళ డాక్టర్ అమ్మ దగ్గర. అందుకే I wanted to sensitize my gynecologists that when women come to us, that we will be able to guide them and help them, be empathetic to them. And the other important aspect is Dheera will be successful if there is complete partnership. Men have to join hands with women, and the whole society has to come forward and say no to violence against women. So this Dheera initiative we started doing public forums, cyclothons, bikeathons, walkathons, radio shows, TV shows, so many media programs we have done. We have involved celebrities, the National Commission for Women, the She Teams, the police, and so many other organizations, press and all, because unless everyone talks about it, the person who commits the violence will not get scared, because it's not possible. Everywhere in the world violence against women is there, not only in India, everywhere, globally. So all of us have to join hands to say no to violence against women. Not only that, as the president of FOXY, I had actually initiated this DHIRA online school certification course. This was in the partnership with the UNICEF India. So I thought it's best to catch the children young, catch them young, 9th to 12th class students. So it's a 2-hour online course, which we started as an online because it was a COVID time. Then we migrated to hybrid sessions, and then now physical programs also happening. So many of my gynecologists in the country, about 6,000 gynecologists of FOXY all over the country, have become the master trainers, and they are training the schools children in different parts of the country. So intavaraku how many schools we have covered chesamante? More than 6,000 schools we have covered in the country, and about 300,000 and 3 lakh students have been covered the whole country with this program. And successful DHIRA program has been even published in the international journal, IJGO. And not only in India, I have been taking this DHIRA to all the countries globally, because I am the FIGO treasurer. This is the second term I am running as the FIGO treasurer. The first time I was unanimously elected. Second time I had an election in October. I have defeated United Nations USA candidate and the Canadian candidate. Especially what was important was in the UN, United Nations, there was a meeting on racial discrimination of women for health. So I have represented FIGO at the United Nations, where I spoke about the commitment of our gynecologists for women's health across the world. For example, you must have all been hearing America, the reversal of Roe and Wade case, where women's sexual and reproductive rights are not given importance. The women don't have a right for safe abortion. So Dani Kuda, we have mentioned this, and this was actually reported back in the AICOG Times and the New York Times. So that was a very successful initiation from our side, and I really feel very happy that I could do it. And the DHIRA program, in FLASO countries, Latin American countries, Cancun, Brazil, Tarvata Monna, Honduras, all these countries we have taken forward, and my team has done it even in Argentina. Europe Poland, Krakow, the European Union conference, we have done this program. Then in Africa, in Kenya, we have done this program. And in other Europe, Italy also, we did in Venice. So globally, many countries lo మేము DHIRA program ni conduct చేస్తున్నాము. So we have got lot of partnership globally. All the gynecologists across the world are joining hands with this initiative to say no to violence against women, and this is a very important project for women's health. Now coming to our conference, we have got about 110 international faculty who are coming for the conference, and locally we have about more than 1,200 national faculty who are attending the conference to share their knowledge of the scientific updates. So we have a 5-day conference. The first day, 6th, we have got workshops. We have got about 14 workshops plus added one more workshop. That 5 live workshops are there. Live workshops are there in laparoscopy, hysteroscopy, robotics, vaginal surgeries, and oncology. Maybe live surgeries and Yashoda high-tech hospital surgeries. Then we have the delegates who are there. And we have got the other workshops on sexual and reproductive rights and human rights, which are so very important, where we have partnering with the UNICEF and the other global platforms. There are also 6th ki workshops, 7th we have the CG Saraya CM in the morning. Evening we have the inauguration. For the inauguration, our Health Minister Garu has agreed to come as the guest of honor. We are happy to have our Health Minister Garu, and we are actually waiting for the confirmation. Chief Minister Revanth Reddy sir also is likely to attend as the chief guest for our conference, because it's the biggest conference which is happening now after Sir has taken over as the Chief Minister. So I'm sure this will be the first major conference which our Revanth Reddy Garu, who is the Honorable Chief Minister of Telangana, will be attending. We are all looking forward to have him with us. The whole country's gynecologists who are there are eagerly seeing, looking forward to see our new Chief Minister also at the inauguration. And we have got on the 8th, 9th, 10th, we have the conferences, 3 days. On the 8th afternoon, we have got the Dhira Public Forum. This Dhira Public Forum, we have got as a guest of honor our Minister, Madam Sitaka Garu, she is coming as a chief guest. We have got some celebrities also. ఎందుకంటే celebrities వస్తేనే మీరు అందరు వస్తారు కదా, అప్పుడే it will be published. This is very important ఎందుకంటే why you have to publish it not for Shantakumari, Aruna or Vidya. మీరు వైలెన్స్ గురించి అగేన్స్ట్ విమెన్ మీరు పబ్లిష్ చేస్తే అట్లీస్ట్ చేసే వాళ్ళు అది చదివితే భయపడతారు. అట్లీస్ట్ ఓహో మేము ఇది చేస్తే వాళ్ళకి మిగతా వాళ్ళకి తెలుస్తుంది అని. అట్లీస్ట్ దానికోసమైనా మీరు కవర్ చేయాలి. మా పేర్లు లేకుండా దట్ ధీరా నో టు వైలెన్స్ అగేన్స్ట్ విమెన్ అనేది ఇంపార్టెంట్ ఆస్పెక్ట్. Then we have got other celebrities in the Dhira. We have got the International FIGO President, Dr. Anne Beatrice Kehara. She is from Kenya. She is my FIGO President. She is the guest of honor. And we have got Priyanka Dutt, who's a film producer. She is also coming for that inaugural of the Dhira program. And for that program, our Foxy President, Dr. Jaideep Tank and Madhuri Patil also will be there for the program. And 8th evening we have some get together. We have invited some of the celebrities. Rana Daggubati is joining us, Nagashwin is going to join us, and Shobita is also going to join us the next day to be with us. And on the 9th we have the Breast Cancer Awareness Forum, public awareness. Women's health is very important. We find that now